Good morning, and welcome to the American College of Surgeons 2022 Clinical Congress. Today we have a meet and greet on surgeons on the front line of firearms violence. The discussion today will be led by Dr. Brendan Campbell and involve Dr. Eileen Bulger, the Medical Director for the Committee on Trauma for the American College of Surgeons, and Dr. Ronnie Stewart, the immediate past Medical Director for the American College of Surgeons. So today we'll take your questions online on the chat and through pressinquiry@fax.org email address. So at this point, I'll turn it over to Dr. Campbell. Thank you so much for being here, and looking forward to a great discussion today. Thank you.
Great, thank you very much. My name is Brendan Campbell. I'm a pediatric surgeon in Hartford, Connecticut, and I have the privilege of chairing the Injury Prevention and Control Committee of the American College of Surgeons Committee on Trauma. Firearm injury is something that gets a lot of attention in the media, and actually, quite honestly, gets a lot of attention at hospitals and trauma centers across the country. And so many people want to do something to try and lessen its impact on our society, which we all see all too often is significant. What we're going to be talking about today during the special session coming up in about an hour is what the American College of Surgeons is doing. And when people say, well, what are we doing about this issue? There are a lot of impactful things that have been going on over the last decade using a public health approach that the American College of Surgeons is doing. So we're going to hear about some of those innovative ways using science and the public health approach that the ACS COT has used. But perhaps more importantly, we're going to hear about things that surgeons are actually doing in their communities, at their hospitals, at their trauma centers, that are based on the best evidence that we have, that are making an impact in their communities and are beginning to, we hope, lessen the impact of gun injuries in our communities and across the country. We're also going to hear from Dr. Bulger about the second medical summit that was co-hosted by the American College of Surgeons in early September, and where we're going, working collaboratively with other healthcare organizations. So with that, I will turn it over to Dr. Bulger.
Well, good morning. My name is Eileen Bulger, and I'm a trauma surgeon at the University of Washington in Seattle, and as mentioned, the medical director for the trauma programs at the American College of Surgeons. Really delighted to have the opportunity to talk this morning about an issue that we're all very passionate about. We see the victims of firearm injury coming through our doors every day, and this problem is only getting worse. It's estimated that during the period of the pandemic, firearm injury, and particularly firearm violence, has increased about 30% across the country, and we see that every day. So to us, this is a very important issue, and we think that there is a real opportunity to make a difference through taking a public health approach and really bringing everybody together to work on this issue. I'd like to turn it over to Dr. Stewart for a few opening comments, maybe also to highlight that common narrative approach.
Thanks, Dr. Bulger. I'm Dr. Ronnie Stewart. I'm a trauma surgeon in San Antonio, Texas. And I've worked with the American College of Surgeons for the past two and a half decades. And for a large part of that, we've worked to develop effective treatments for firearm injury and violence, and we've really put our heart and soul into preventing unnecessary death and suffering related to intentional injury and firearm violence specifically. We've learned through that process that we can make great progress if we commit to work together to do two things. If we work together to understand and address the underlying root causes of violence, while simultaneously working to make firearm ownership safer. We've learned that to do that, you have to engage. You have to engage with firearm owners. You have to engage with communities at risk for firearm-related injury, and engage those communities as part of the solution, not the problem. And we've learned that if we take that approach, we can make dramatic progress together, hand in hand. We've learned those lessons. So it's an honor and privilege to be here.
Well, so I'd like to just open up the floor to see if folks have questions for us. We'd be happy to entertain any questions relating to firearm injury or the session that's coming up.
So, Dr. Campbell, one of the questions we have is that Dr. Bulger mentioned taking a public health approach. Can you all discuss a little bit more about what it means to take a public health approach to firearms violence?
Sure. So whenever we're asked that, what are we going to do about the epidemic of gun injury in this country, we have to take a careful look at as Dr. Stewart mentioned, the root causes, but really the epidemiology of gun injury, and look at specific examples. Breaks down into unintentional injury, homicide, suicide, and specifically looking at the causes of those and designing and implementing and testing those measures which are most effective. So you can't just say we have to do something. You have to look at the problem constructively and act on it. And some of the things that we have consciously advocated for are things like federal funding to study firearm injuries so we can better understand how these injuries occur and what types of interventions are most effective.
And I'll add to that I think that there are also practical interventions that we can do. We've learned that things like campaigns around safe storage of firearms, promoting firearm safety, reduce the risk of suicide, for example, because you have a weapon in your home that's stored securely, your young child can't get access to it. It reduces the risk of both unintentional injuries from accidental discharges, but also the risk of suicide in the home. So there are lots of practical strategies we can take, again, thinking from a public health strategy about how to intervene. I think on the community violence side, we've done a lot of work looking at the social determinants of violence, and there's a lot of work to be done in our communities to improve issues that lead to inequity and lead to a culture of violence that needs to be overcome. So there's work going on about how to better invest in communities, how to establish hospital-based violence intervention programs. All of these things are practical steps that align with that approach.
I'll just also comment that I talked about the framework for at least how we think about how to work together. And to me, a public health approach means treating a complex problem with the appropriate nuance and complex, a multimodal approach. And we put together two work groups. One, a group of really mainly passionate firearm owners. They have 14 recommendations that I think are all actionable, some policy, some not policy related recommendations, and then a group working on social determinants of health and equity, and they have 4 really great broad recommendations, which I commend to everyone. Those are all on the website of the ACS and all open access.
Great. Can you speak a little bit more about the firearm strategy team task force recommendations, the 14 recommendations that you alluded to, just how they were developed, and what are some of the areas that they cover?
I'm going to take it. So just a little bit of brief background on the firearm strategy team. It was a group of 22 passionate and experienced firearm owners with military law enforcement experience. And basically this group came together and identified 14 actionable items that were practical and had unanimous agreement among all 22 participants in the work group. Things that aren't really a surprise to most of you, like background checks, requiring safe storage, thinking about possibly reclassifying assault-style weapons and others. Like Dr. Stewart said, these are all available. And I think what's important is, this was approached, from gun owners. And I think if we want to address this issue, you have to look at it through the lens of there are a lot of responsible, law-abiding, gun-owning Americans in this country who are doing the right things and want the same thing as people who are opposed to gun ownership. None of us wants to see children and older Americans being injured by firearms. So the firearm strategy team not only was one effective approach that we found to addressing this issue, it's one that we're planning to work more on in the future and continuing to refine those recommendations.
And just piggyback on Dr. Campbell's comments, one of the the goals or the approach of the firearm strategy team was to work on strategies that, as firearm owners, that did not infringe on Second Amendment rights, that could be done in a way, and I believe would make us more free. If we followed all of the recommendations of the firearm strategy team, I believe we would be have greater freedom and definitely not infringe on Second Amendment rights. So I think that's the power of such a work group is you get the expertise of people who are firearm owners, who really do view Second Amendment rights as extremely important. So those recommendations came from that group. And that approach also takes that's exactly how we would do this health and this public health approach we're talking about is exactly the way there's been a revolutionary improvement in automobile safety, traffic safety. It's the exact same approach that we've taken with automobiles and bicycle safety, we haven't yet really truly implemented that strategy with respect to firearms, and there's great potential to make us both safer and more free.
Just to expand on that point a little bit, given the philosophical divide and the divide we've seen on the pro-gun owners and the anti-gun owners, what are some of the ways that you've worked over the last several years to bridge that divide and bring both sides of the table together, so to speak, to have conversations about this issue?
Well, we've approached it as a medical and public health problem, not a political problem. Okay, so one approach. Second approach is we're looking for strategies to reduce violence. So we're looking for evidence-based violence intervention for communities and for trauma centers. And the third thing is we're very mindful and conscious about making ourselves a forum for a civil, collegial, professional dialogue on the topic. And in some ways, I will say that over the past decade, we've learned that some people felt in our team that this was a radioactive topic, that we couldn't talk about it. It was radioactive. And through the work of the American College of Surgeons, I think what's happened is it's gone from being radioactive to attractive. It's become something that actually firearm owners and those who don't own a firearm actually are working hand in hand together. And that doesn't mean they agree on everything. It doesn't mean we agree on everything, but we use an inclusive approach where we're engaging people who have the expertise, and that framework gets people working together, not fighting. And we should not expect a problem that is fundamentally a violence issue to be solved by a violent debate. We should not expect that. Will not happen. But working together, we could revolutionize the health of our children and our communities by working together.
Yeah, I do think it's important to note from the epidemiology side that firearm injury is the leading cause of death in children in this country. It is far and away more children die from firearm injury than anything else. And that should be a wake-up call for us. That should tell us that we need to make some impact here. And we can only do it by working together. The more polarized we are, the more we go into our own camps on this issue, the less gets done. So our goal is to bring people together, to develop evidence-based solutions, and to implement them. And that's what we're about.
Thank you, Dr. Bulger. And speaking of bringing people together, so you had your second annual summit, or not necessarily annual, but second summit on firearm violence, and you all had more than 40 groups at the table, right?
Yeah, so we've been working hard to make this not just a surgeon issue, but really a House of Medicine issue. And so we brought together in 2019 45 major medical and injury prevention organizations for a two-day summit to really talk about this issue, to think about our approach, to develop solutions. And then we repeated that just this year, back in September of this year, and had at this meeting 47 major medical organizations. There is huge consensus among the medical community on the approach to this problem. We really do think that we can make a difference with this strategy. And our goal coming out of this summit is to really have a coalition that continues to work together across the House of Medicine on this issue. There's a lot we can do, both within hospitals and healthcare systems around counseling our patients, working on violence prevention programs, working hand in hand with the community on helping manage and treat the victims of firearm injury and their families to try to reduce recurrent injury. So we do think there's a lot within the health care community we can do, and we think coming together, we can also advocate for change.
Great, and you mentioned the House of Medicine, but one of the questions we've received is sort of, why is this such an important issue for surgeons to be involved in this issue?
Well, because it's really a critically important issue for our patients. Surgeons are the ones who wind up caring for the patients when they're shot, when they're injured, when they have violence from other means. So we literally, our teams are on the front lines, but we're very, very mindful, and I think everyone should know, this is a surgeon issue. It is, I think it's the most important problem for the patients I treat. It's definitely the most under-addressed problem, the most neglected problem. So it's critically important that we address it and that we speak for our patients. That doing the right thing for our patients, that's why surgeons are involved, should be involved, and must be involved. However, we recognize this is not, that there are others in medicine who also work with a big piece of this. So we have great partnerships with emergency medicine, with pre-hospital professionals, paramedics, EMTs, and really this is a physical trauma issue and an emotional psychological trauma issue. So we have great partnerships with mental health professionals and mental health organizations. So. And that is the public health approach. I know some people don't understand, what do you mean when you say a public health approach? Well, it's actually all approaching it from multiple different facets and working together to reduce injury and to optimize recovery and return to normal function for our patients.
I'll just piggyback on that. From our perspective, these sudden traumatic injuries are really devastating to our patients, and they're devastating to their families. And we have to witness that every day. We have to talk to the loved ones of those that don't survive. And that's heartbreaking. We think of injury, as a moment of crisis, but really it's an entire lifetime of impact. And so our goal as surgeons is to reduce that rate of injury across our communities. And this being one of the leading causes of injury, particularly in children, is something we think is critical to address.
That's so true, Dr. Bulger's words, a moment of crisis with a lifetime of impact. It's so true. And, part of our job is to keep it from being a moment of impact with the person who then has a lifetime of crises after that. And by working together, we can make real differences. And then on the issue of trauma to children, there's really, it's a fascinating story that childhood injury does really and truly have a lifetime of impact. It has a whole host of consequences in many chronic diseases so if we do something early to address, to improve, to prevent, and then improve the care, we can make really an amazingly positive change on someone's life and then their children's lives after that.
Great, thank you, Dr. Stewart. Speaking of impact on children, you treated victims from 2 mass shootings. Can you speak about the most recent one in Uvalde and sort of how that has helped solidify your advocacy efforts and the work that you've been doing to advance this issue?
Yes, it is true that our teams have cared for 2 of the largest mass shootings in U.S. history in the past 5 years. And again, speaking for my patients, speaking for them, I know these horrific tragedies are preventable. I live very much in the real world. Can we prevent everything? No. But by taking this approach that we've talked about working together, we can dramatically reduce the frequency of mass violence, of mass shootings. And actually, the Firearm Strategy Team's recommendation, if I've coming out of the Uvalde Robb Elementary School mass shooting, I've reread that Firearm Strategy Team paper probably half a dozen times myself, and I was one of the authors on it. And if you want to know pragmatic things that we could do to prevent those tragedies, I really recommend just carefully reading and looking at that Firearm Strategy Team recommendations, and then a follow-on, looking at the ISAVE, the Improving Social Determinants to Attenuate Violence paper, which really puts the framework of how we can ultimately get closer to the root and put a framework in our communities that would actually make us safer, healthier, and better in many profound ways. So that's what I would say.
Excellent, thank you. So with that, that's all the questions we have. So Dr. Campbell, if you want to make some final comments, or anybody else on the panel make some final comments, we can wrap up.
Sure. I'll just tag on to the comments that Dr. Stewart had made there at the end about, we're not going to be able to prevent any of all of these things, but we certainly have many actionable things that we can do. And in the aftermath of the Sandy Hook shooting in Connecticut, we had held a health policy forum and invited a high school principal to speak at it. And he was asked the question by someone in the audience, can you prevent another school shooter from coming into your school and doing what was done in Sandy Hook? And he said, you know what? He said, I can't. But what I can do is I can prevent another student from becoming an Adam Lanza. And he went into his description of the anti-bullying strategies that they put in place in their school and how effective it had been. And I think that gets at what Dr. Bulger, Dr. Stewart, and I have been talking about. There's no easy solution to this, but we can identify good ones and try and implement them in our communities, in our trauma centers, in our schools. And it's those sustained efforts when the media isn't looking at us that are most apt to make a significant difference in lowering injury rates.
Great, well, thank you. Well, with that, we are concluded for today. Good luck on the rest of your panel, and thank you for taking the time this morning to answer some questions.
Thank you.
Thank you.
Knock the table over, that'd be good, wouldn't it?